we generally advise not to drive for the first 6 weeks. After 6 weeks, if you feel that you have regained enough strength to do an emergency stop, or if you are not taking any painkillers which would affect your reaction time, you can start by driving short distances. Let's talk about sleeping position after surgery. After a hip replacement, you should avoid sleeping on the unoperated side for the first few weeks due to the risk of dislocation. You can sleep on the operated side once the ward is comfortable. If you have had a knee replacement, there are no specific sleeping instructions, but you should not put a pillow under your knee while going to sleep. What about flying off on an exotic holiday after surgery? The advice is not to fly for the first 3 months due to the risk of blood clots. While kneeling is not prohibited, one should ensure that they have enough bend in their knees and be able to get on and off the floor safely. With regards to the hip and knee replacements we do nowadays, we expect them to last 20 to 30 years. One of the commonest concerns from patients while discussing surgery is whether they would be awake during the procedure. In the majority of cases, you will be offered spinal anesthesia, which means you won't be awake. You will be usually offered sedation as well. If for any reason you cannot have spinal anesthesia, you will be given general anesthetic and will be asleep during the procedure.